Hello, my name is Gina Gray and I'm going to do the oral medication video. Skill video, and this skill video, I'm gonna do the one where you have the docusate sodium, warfarin, furosemide, potassium chloride, and the liquid Tylenol. That is I choose number one. Okay, and so for every time we give medication, we have to verify and know the 6 rights of medication, which are the right patient, the right medication, the right dose, the right time, the right route, and the right documentation. And for today, we have, since we're doing oral medication, I have 4 oral medication and 4 pills or tablets and 1 liquid. The Tylenol one would be the liquid. And so before I go to the patient's room, I go ahead and check all this medication and take the medication. If it's the correct one, I have the docusate sodium for 100 milligram. I have the potassium chloride 20. I should have to show it. Warfarin and furosemide and Tylenol. And the Tylenol. Okay. So in confirming the medication, then I am now going to the patient's room. Okay, knock knock. I'm gonna go ahead and close the door, provide privacy, and do hand hygiene. Hi, Miss Jones. My name is Gina, and I'll be your nurse. May I have your first name and last name and your date of birth, please? And let me see your wristband. Okay, it's just to verify that you are the right patient, right? Okay, do you have any type of allergies? No. Okay, no allergy with medication, no allergy with food, no allergy with seasons. Okay, that's good. Okay, all right, let me go ahead and check your MAR again. These medications are yours. Right patient, yes it is. Okay, that was our second verification. All right, so I'm here because you are going to be taking all these medications prescribed by your doctor. The first one, I want to talk about the docusate sodium. So this one is actually a stool softener, and what it does is it pulls the water from our body into the stool so that the stool will be soft enough to exit the body. Okay, a little bit of side effect for that would be a little bit of discomfort or diarrhea in the stomach, right? A little bit of stomach diarrhea, a little bit of diarrhea, and maybe a little bit of stomach cramps, right? And some adverse effect might be electrolyte imbalance, but it's rare. But we do want you to know that it can happen, and some allergic reaction like rash or swelling. Okay, and then for the second medication I want to talk about is going to be warfarin. So warfarin is a blood thinner, and warfarin does is inhibits the creation of clot in your body, and it doesn't want to clot, and then it inhibits vitamin K from clotting in your body too. a little bit of side effect would be minor bleeding, or you can bruise a little easily, right? And but then an adverse effect is gonna be severe bleeding, or worse, necrosis, which we don't want. So I want you to know that. So if you have any symptoms, you let me know as soon as possible. And the third one is furosemide. This furosemide is a diuretic. Furosemide removes water from your body. Just want to eliminate it in case you have heart failure, you have hypertension, edema, hypertension, heart failure. What's the next one? We have potassium chloride. So the potassium chloride, it helps replenish your potassium, and it restores the normal cellular potassium levels in your body. And what it can have some side effect like nausea and vomiting, and then diarrhea too. But adverse effect, in terms of adverse effect for potassium chloride, is not good. It's hyperkalemia. It is pretty dangerous. It has muscle weakness and arrhythmia. It affects your heart, and you can have some GI ulceration. So we don't want that. Those are adverse effects that you have to let me know, so we can address it right away as soon as possible. Okay, and lastly, we have the acetaminophen, and that one is a pain reliever, pain and like fever relief. It's anti-inflammatory, so but it does have some side effect of nausea and like maybe rash. Okay, an adverse effect, you might have liver toxicity, but that's more like chronic or like overdose, and severe skin reaction, some allergy as well. Okay, now do you have any question for me? Okay, no. All right. What am I gonna do now? Okay, I'm gonna have you sit up so you can take these medications. Let me go ahead and hand hygiene and put on some gloves. Okay. Okay, I'm gonna imagine these are all open. I'm gonna take all this medication. Let me verify your medication for the third time against Lamar. Okay, this is correct. This is right. Okay, so imagine these are empty. Have you sitting up? You can take all this medication at once, 4 of them. Is that fine? Yeah. Okay, go ahead. Here is this, and then here's some water. Okay, good. Okay, now I'm gonna, once you're done with that, I'm gonna open this Tylenol. Actually, let me you shake it first. Okay, and then I'm gonna open it. I'm gonna set it down with the cap upside down so it doesn't touch the bottom. And then since this is the name of it, I'm gonna cover that up. So I'm gonna be on the other side, cover the name, and then I'm going to pour it into this container where we can measure 15 ml. Gosh, I can see. Okay, I'm gonna set it in the flat surface, and then I'm gonna go ahead and pour it and make sure I'm not putting the neck, so it doesn't touch the measuring cup. Okay, maybe get some clean tissue. Now we're gonna just wipe the bottom, not the inside. Wipe a little, wipe. Okay, and then close the lid. So this is 15 ml. I'm gonna go ahead and show the camera. Shit doesn't work. $15. Okay. Do you need water for this? No? Okay. You're doing this. Okay. You did it. Alrighty. Now that you have taken all your oral medication, I'm gonna go ahead and remove my gloves, and I am going to put on some hand sanitizer. And I'm gonna go ahead and document it, okay? Thank you so much, Ms. Jones.